Hi everyone. Now we are going to see the last part of Unit 2 hemodialysis. Already we have seen about the core subjectives of this subject, also the 5 units of this subject, and these are the course outcomes of the assistive technology. And now we are going to see the final video of the final lecture of the hemodialyzer unit. In part 1 and part 2, we have seen what is dialysis and what is hemodialysis. Now we are going to see the another type of dialysis, which is peritoneal dialysis. Peritoneal dialysis is a type of dialysis that uses the abdominal peritoneal lining of our human body as the membrane. So it is called as the peritoneal dialysis. The membrane will remove the fluid and dissolved substance and exchange the blood to remove the toxins and excess fluids and to correct the electrolyte imbalances. This is the peritoneal dialysis setup. Here, this is our peritoneal of human body. Here, this is known as peritoneal cavity. This is the tubbing set. Clean solution will be sent to this peritoneal cavity through this tube, and waste products will be removed through this tube. This is the hold solution. This is the process of peritoneal dialysis. And these are the types of the peritoneal dialysis. First one is continuous ambulatory peritoneal dialysis and automated peritoneal dialysis. Third one is intermittent peritoneal dialysis. Continuous ambulatory peritoneal dialysis depends the human intervention. Human need continuously it will be ambulated through the human or any technical person. And second one is automated peritoneal dialysis, which will be automated from the removal and returning the blood. Everything will be automated in this case. And third one is intermittent. It is semi automated, like human intervention will be in the intermediate part only, otherwise it will be automated, so we can say it as semi automated. When we have to use the peritoneal dialysis, these are the indications: vascular access failure, intolerance to hemodialysis. The patient who can't adhere to the hemodialysis procedure, we can go with the peritoneal dialysis procedure. And congestive heart failure, and finally, when the patient will have prosthetic valvular disease, we can go for the peritoneal dialysis treatment. Procedure of hemo peritoneal dialysis. First, the nurse will prepare the patient and family for patient for the peritoneal dialysis. It will be depend on the patient's physical and psychological status and level of alertness and previous experience with the dialysis process and understanding the familiarity with the procedure. The nurse explained the patient about the procedure and get sign from the concerned person, and they have to get sign of consent, and they have to ensure with the baseline vital signs and weight and serum electrolyte. Everything should be recorded before the procedure. And evaluation of the abdomen of placement for the catheter. The nurse will ensure the patient's abdomen for the catheter position. Preparing the equipments. Assembling all the equipments needed for the peritoneal dialysis process. The nurse will determine the concentration of the dialysate to be used and medication to be added to it. And what are the medication we can use here is heparin, potassium chloride, and additional antibiotics, and regular insulin will be added, and aseptic technique will be used here. Before medication or added to the dialysate should be warmed to the body temperature of the patient. Solution that are too cold, if it is too cold, it will cause pain or cramp in which will be create the patient discomfort. So for this dialysis warming, we can use the dry heating procedure. We should not soak the bags into the warm water, or we should not uh, warm through the micro oven. Dialysis will be warmed through only dry heating procedure. Immediately before initiating the dialysis using aseptic technique, the nurse assemble all the administration set and tubbing here. The tubbing is filled with the prepared dialysate. This is the tub. Here we will fill this tub with the dialysate solution, and the amount of air entering the catheter and peritoneal cavity which could increase abdominal discomfort. So we have to ensure there is no air flow into the peritoneal cavity. We can continue the procedure without any discomfort of the patient. Next procedure is inserting the catheter. The peritoneal catheter is inserted into the operating room or radiology suite to maintain the surgical auspices or to minimize the risk of contamination. So, however, in some circumstances, the physician may insert the rigid catheter at the bedside using strict auspices. We can use normal bedside procedure also for the insertion of the catheter, but preferably operating room or radiology room will be suitable for reduce the contamination. These are the different types of catheter used for the peritoneal dialysis procedure. This first one is standard Technoff catheter and swan neck catheter, which will be like a swan neck. So this is named as the swan neck catheter. And the final one is coil catheter. It is have two rounds, so it is known as coil catheter. These are the catheter used for the peritoneal dialysis procedure. Thank you.